Hi everyone, I'm Steve, owner of multiple health clubs and health and wellness nutcase, here with Dr. Nario of Biointegrative Health Center. Biointegrative Health Center is in Reno, Nevada. You can check them out online and learn about all the different treatments and what they do at the clinic there. So welcome, Dr. Nario.
Hi, Steve. Thank you for having me again.
Okay, so let's talk about progesterone today. What is it?
So, Steve, that's a pretty good question. Well, the thing here is, when we talk about progesterone, people think that, oh, this is a video for women, or is it? Maybe you'll find out that there's more to it than that. Well, it's more prominent for females because it's a sex steroid that they make predominantly, and it's a hormone that is secreted by what we call the corpus luteum, meaning this is the remains of the ovarian egg or follicle that release that mature egg during a previous ovulation. So to prepare the uterus for implantation and later by the placenta during pregnancy to prevent rejection and the development in the process of developing that embryo or fetus. Again, predominantly it's released after ovulation. That's why this hormone is very high after day 14. Levels of progesterone remains elevated throughout pregnancy. And elevated levels, again, prevents the body from producing additional eggs during pregnancy. So you only have one most of the time in terms of carrying a baby. And eventually, progesterone also helps trigger lactation or breastfeeding. Benefits are not only during pregnancy, but also in other health aspects. For menopause and men, adrenal glands are the ones that creates, and specifically for men also, the testicles create progesterone in terms of the other sex.
Okay, so are there symptoms if progesterone is maybe off, maybe we're deficient? Are there any type of symptoms that would indicate this?
Yeah, so again, this discussion, Steve, I don't want to be biased, but majority of the symptoms of deficiency comes from females, or more predominantly seen in them. And involved with this would be heavy prolonged menses, severe pain during menstrual cycles, mid-cycle bleeding or bleeding when they're not supposed to be bleeding yet, so it's not on schedule. And also, again, in pregnancy, miscarriages can happen. But the non-reproductive type of symptoms, insomnia, mood irregularities, and even possibly aggressive atypical behaviors, even anxiety, PMS as they call it. So ask husbands or boyfriends who becomes the punching bags during these periods, and maybe a little progesterone is all they need for their partners. Again, when women have histories of fibroids, polyps, and even a typical early bone loss, that could be a sign of low progesterone. And since all hormones function, and I guess altogether, other hormones can be affected also if this specific progesterone level is low. And for men, so let's not be biased here, may manifest deficiency, as I see more of clinically, in relation to their mood changes and even anxiety.
So is there multiple? I mean, what are progesterones? What does it do? What are the actions?
Yes, Steve. So the progesterone, actually, again, going back to the females, progesterone prepares the uterus for implantation of the fertilized egg and causes the glands of the uterus to grow. And at the same time, for the breast, it also enhances it so that it can be a milk machine during lactation or breastfeeding. And the word itself, progesterone, gestation meaning pregnancy, is the one of the main hormones for pregnancy. It also is the police. So why do I say it's the police of the body? So it also guards the gut wall. This is often when we see during pregnancy that the immune conditions of women goes down because majority of the leaky gut gets repaired by predominance of progesterone. And also it opposes the estrogens, bad effects or growth signals. So when we talk about uterine cancer and even breast cancer, we're talking about overstimulation of estrogen. And that's where progesterone comes in to say, yep, hold on, don't overdo it. And then cancer hopefully will be kept on its track. And balancing hormones with estrogens also is something that progesterone does for protection. It also is good for the immune system, for it switches the immune system that is pro-inflammatory into an anti-inflammatory state. So calming down those immune system, especially when you have autoimmune conditions, for example. And when we talk about the brain, the nervous system, it also is an anti-anxiety hormone, which is protective against various injuries of the brain, like TBI, traumatic brain injury, and also it repairs it. So now let's go to your question. Allopregnenolone or pregnenolone is the metabolite of progesterone, meaning progesterone turns into this specific hormone, which actually is a brain protector or maintenance of brain memory. And also it acts as a modulator for the GABA receptor, which is a calming neurotransmitter, and promotes it. It's almost like a natural clonazepam or diazepam or even benzodiazepine to calm the brain down and to promote memory.
Okay, so what about men? You said this mostly applies to women, but do men need progesterone? Can it be high? Can it be low? What about men?
Well, let's not leave the men out, because that's for us to learn. They might think that we're only focusing on women here, but not forgetting about men. Low levels of progesterone have higher anxiety in terms of symptoms: low libido, hair loss, weight gain, fatigue, depression, ED, impotence, bone loss, muscle loss, enlarged prostate, and even prostate cancer. Now it makes you think that it's very important for men too. And again, men has the tendency to be estrogen dominant. And a big clue for you, unfortunately, for the ones who has this gut belly, that heavy weight in the front actually is a converter of testosterone into more estrogen. That's why if you're more emotional and crying over chick flicks, you're definitely estrogen dominant. And other contributors to estrogen dominance would be the environment, when we drink from BPA from plastics, and even our food that's laden with insecticides and pesticides, the milk and the meat that we eat, the hormones that it has, and even the alcohol intake, which is supposed to be in moderation, the chronic stress, and even, yes, the more fat cells we have, it's just a bad equation. It's adding insult to injury. And it's in our fat that what we call the word aromatize or convert testosterone to estrogen. And that actually tends to make men and women even fatter. And the vicious cycle just happens over and over again. Thus, as I can summarize in a sentence, that progesterone helps men preserve their masculinity.
So that it has to be high enough. So
it has to be normal. I don't want to say high for the reason that there are also bad effects, because when you have high levels of progesterone, you're more prone to have diabetes. You're also prone to depression, also sleepy in a way when you wake up. So just the right levels, that's why we need to check.
And then too low would be what you just described before that.
Yes, definitely.
Okay, so if there's deficiency, what do you do? Is there a way that you can treat this, or what do you do?
There is. So again, going back to our women audience, there are two ways to address this, meaning conventional, also integrative. So for conventional, there's a synthetic form that they give, and they would be heard as the name calls them Provera or Progesterol, just examples of synthetic progesterone. And also there is bioidentical, meaning it's almost similar to the construction or the chemistry structure of your own body and what you create, which is more acceptable for the system. And studies have shown for menopausal women, estrogen and progesterone may be used in relation to people who has hormonal imbalances, and actually had lowered breast cancer risk compared to using synthetic. So I'm talking about bioidentical. And there's also low growth rates of uterine and colon cancers, and may also be useful for ovarian, melanoma, and even for men, prostate cancer. Even the WHI study reported that the use of hormone replacement therapy containing estrogen and progesterones, which is synthetic, is bad for cancer, but the bioidentical one actually is more beneficial, even for specifically for colon cancer. So let's talk about mode of deliveries. How can we give progesterone? One is oral, and there's a form of sustained release and fast acting. That's the most common that we give here in the clinic because it helps a lot with sleep. Sublingual, under the tongue, topical, you rub it on the skin, vaginal, down there. And also intramuscular, we rarely do that. And IV therapies, this is mostly done in the hospital for research settings. And when we give it to women, the oral, we give it in a cycling manner. We give it from 10 to 25. This is for reproductive age, day 10 to day 25 of their cycle. And for menopausal women, day 1 to 25, and rest for 5 days and then restart again. For men, I usually see this used in more acute moments, such as anxieties, high blood pressure, and they use it as a cream. They're not as predominantly used like how the administration schedule of females. And when I talk about the benefits, I usually see clinically a lot for my patients the benefit of sleeping better at night. For the reason that when you take it orally, 20 minutes, it's going to be acting on your brain. And also it produces the allopregnanolone that I just mentioned to you, or the pregnenolone metabolite, to calm the nervous system down in the brain and assist with deeper restorative sleep. And also it's broken down fast and you wake up the next day feeling great. The natural production of progesterone in men is actually is created. When I spoke about it a while ago, this is the internal production of progesterone. But naturally, we have it, but we also do external supplementation. And as I mentioned to you, it's not used much compared to women, but I see it more in prostate cancer, quick fix for anxiety and blood pressure issues, and even insomnia. But always be guided by your medical doctor. Always get levels, as I say. In our practice, we assess this through saliva or urine, which is the most common and more accurate for us, or even blood, which is least accurate, but will be covered by your insurance.
Okay, well, as always, great information, Dr. Nario. Dr. Nario, again, is with Biointegrative Health Center. You can check him out online. They're in Reno, Nevada. Thanks for your time, Doctor.
All right, Steve, thank you so much. We all know knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.